Dr. John Kayode Fayemi assumed office as Executive Governor of Ekiti State on the 16th of October 2010. The Fayemi administration, since the assumption of office, has been unequivocal in its articulation of its vision towards the transformation of the state. An 8-point developmental agenda was put in place as a framework to achieve the vision for this transformation. This framework contains interdependent goals that serve as the means to an ultimate end, which is an Ekiti that all the citizens can be proud to call their own, and a legacy of peace, stability, and development. The fifth on this 8-point agenda is health care delivery. This is an understanding of the preeminence of good health to socio-economic and political development of every society. In appreciation of the need to have a healthy society in order to develop as a state, the Fayemi administration declared a state of emergency on the health sector in Ekiti State. It put in place many strategic plans to achieve this. These plans consist of various innovative ideas, policies, and programs. They are designed to enhance the quality of health care delivery to the Ekiti people at home and beyond. The enormous responsibility to translate these policies and programs to concrete dividends rests on the shoulders of the Ekiti State Ministry of Health. The Ekiti State Ministry of Health is a government establishment with a mandate in line with the agenda number 5 of the administration to ensure the total health and wellness of the Ekiti people through an effective disease control, prevention, and possibly care. As an institution, the ministry seeks collaboration and collaborates to promote and provide equitable and accessible qualitative healthcare service delivery to Ekiti people in general. Structured to cover major essential areas that can efficiently sustain and manage effective discharge of the responsibilities of projecting the Ekiti government's vision in the health sector, the Ministry of Health has various departments. These include 1. Administrative and Supply Department, 2. Finance and Accounts, 3. Health Planning, Research and Statistics, 4. Hospital Services and Training, 5. Public Health Department, and 6. Disease Control, 7th. Nursing Services Department, and 8th. The Department of Pharmaceutical Services. For proper service delivery, the ministry coordinates projects like the World Bank-supported Health System Development Project 2, as well as the Unified Drug Revolving Fund, UDRF. For efficiency, the ministry also supervises some health agencies like the State Primary Health Care Development Agency, Hospitals Management Board, HMB, the University Teaching Hospital, the Central Medical Store, and the Ekiti State College of Health Technology, Ekiti. With seasoned medical professionals at the head of the administrative saddle, the ministry's functions include monitoring and formulation of health policies at all levels for the state government, ensuring the proper interpretation and implementation of the national health policies, provision and proper management of funds for the effective running of healthcare services in the state. The ministry is also responsible for the collection, analysis, managing, storage, and retrieval of vital health information or statistics for use in the effective planning and implementation of health programs. It's also responsible for the control of the sales and use of dangerous drugs and narcotics, as well as the regulation and registration of private health facilities. The ministry acts as a link between the federal, the local governments, and various developmental partners connected to the vision to provide public health services. Since October 2010, the Ekiti State Ministry of Health has commendably and steadily paddled towards the accomplishment of the 5th agenda of the Kayode Fayemi administration. The policies and programs of Dr. Fayemi pertinent to the healthcare service delivery are being implemented in a manner that confirms clear understanding and commitment to the vision of His Excellency, the Executive Governor of Ekiti State. Some of these programs are free health services and free health mission.
The Ministry of Health agenda, in addition to Dr. John Kayode Fayemi, liaise with qualitative and functional healthcare delivery in the states. Focuses mainly on free health program for all pregnant women, the under 5, the elderly, above 65, and the physically challenged citizens, including free treatment for HIV comorbidities. And besides this, it extends to care for virtually everybody in the state, at a very much reduced price, particularly for those people that are not covered by the free health program. In spite of that, the state also offers some degree of medical assistance to people too that are not covered within that free health program. And besides, we do intervention treatment in the form of health missions regularly. Prior to my coming on board, we've been doing it every 3 months. And to date, we've done about 5. And this tends to fill the gap that was not covered by the free health mission. Besides this, we've had a lot of interventional treatment, particularly to some neglected tropical diseases like tuberculosis, like tuberculosis, even leprosy across the state. And we also have some focused treatment on malaria, and we have focused treatment on children under 5. Specifically, we will involve in immunization programs to ensure that our children do not die, and to ensure that our mothers do not have repetitive deliveries that normally send them to death because of the demand of having many children. So all in all, we've been working, our work numbers, as regards Dr. John Kayode Fayemi is on course, and I think we have achieved quite a lot in the areas of primary health care, secondary health care, and tertiary health care.
Holistically, if you look at the 8-point agenda of Mr. Governor, they are all health related. In the sense that if you look at the women empowerment and gender equality, they are highly very involved in health matters. If you look at agriculture, you have to make sure that there is a food security for people so that they don't have malnutrition. And if you look at infrastructure with good roads and then other social amenities, they are there. But specifically looking at the 5th point agenda, it provides free health services for the under 5, pregnant women, physically challenged, senior citizens of 65 years and above, and then making sure that we are able to increase our immunization coverage, of course, having 100% there, and then making sure that there is accessibility of health facilities. In achieving this, Mr. Governor had been very, very gracious and very, very supportive indeed by providing political will and commitment to us. We have the free health program facilities in the 35 free health facilities across the 16 local governments in the states. And then there we have the personnel that are mixed personnel there. We have equipment like Mr. Governor had approved and released funds for the procurement of equipment, various equipment like solar freezers, generating sets, ultrasound machine, and all whatnot. All these things that we add to having a functional free healthcare delivery system. And not only that, we have the infrastructural upgrading of most of all these facilities.
The provision of free medical services to the people of Ekiti State is very premier among the health policies of the Fayemi administration. This policy, which was launched on the 25th of July 2011, is being implemented by the Ekiti State Ministry of Health with a guileless commitment and sincerity towards evolving a disease-free society. This program ensures an increased immunization coverage and the regular provision of basic and essential health services to vulnerable groups within Ekiti State. The program, which was designed towards removing the financial barriers to quality healthcare benefits, has also been described as a calculated and conscious increase in the efforts towards achieving the Millennium Developmental Goals, MDGs. The program is a facility-based model designed to ensure the delivery of high-quality and high-impact health services to the target groups. There are 293 primary health care facilities across Ekiti State. These facilities, spread all over the 16 local government areas, are made up of comprehensive health centers, basic health centers, and health posts. The free medical services are currently being accessed from 35 health facilities drawn across the 16 local government areas of the state to serve as pilot study. Plan is, however, in place to expand the scope of the program. Currently, there are a minimum of 2 health services facilities per local government. The referred cases from these facilities are being handled at the secondary health facilities. There are 20 secondary and 1 tertiary facilities owned by the state government, with at least 1 general hospital in each of the 16 local government areas of the state.
The Hospital Management Board is, as you know, is a parastatal of the Ministry of Health, and by the head that set it up, we have the responsibility of overseeing the secondary facilities in the state. And under our care, we have 3 specialist hospitals, 17 general hospitals, government health clinic, staff clinic, and some other minor clinics under our care. And we have the responsibility of making sure that we ensure effective service delivery in these centers. We also have the responsibility of ensuring that there is a provision of adequate manpower, infrastructural development. We have about 4 components of the free health services, but our major role is to receive referrals. We receive referrals from these primary facilities. So we take care of those patients that are referred from that primary health facilities to the secondary facilities. And up to that level, all the care we render for referral cases, they are completely free.
The basic and the comprehensive health centers are considered very important because they are the major entry points of the free healthcare services. Their importance is born out of the fact that they are very accessible to the people at the grassroots communities, on whose lives national health policies and systems are designed to positively impact.
There's high patronage of clients in this facility.
We have Irepo in Felodun local government. This is Irepo. This place is meant for the free health program of Dr. John Kayode Fayemi, which started last year, August 25. And during this program, government has been doing a lot of things for us in this center by providing good equipments, drugs, and everything that we need. Anytime we call on them that we need this thing, they will give unto us. And during this free health program, people have been coming. Initially, our people didn't know the importance and the advantage they can get from it. But through outreach, home visits, letter to the churches, And even in our attendance to them in this center, they are becoming now.
The characteristics and features of the free health program of the Ekiti state government include: 1. Free immunization to children from age 0 to 5 years. 2. Free immunization for women of childbearing age against tetanus. 3. Free antenatal care and facility deliveries, assisted deliveries, cesarean sections, free all-inclusive services for pregnant women. This includes free consultations, investigations, drugs, bed fees, and nursing care. 4. Free mass immunization against deadly diseases like yellow fever and cerebrospinal meningitis during epidemics. Number 5. Free treatment for ailments like malaria, acute diarrhea, and respiratory tract infections. 6. Provision of health information, education, and communication materials for effective prevention, control, and management of communicable diseases. 7. Free treatment to every physically challenged registered senior citizen from age 65 and above. 8. Free supply of micronutrient supplement to children within the age 0 to 5, as well as every pregnant woman.
This organization is reputed for servicing the general populace with provision of genuine, essential, and affordable drugs at all times. In fact, this place is ISO certified and is one of the few ISO public health certified facilities in the country. We boast that our system is the best in the country because several states, including the Federal Capital Territory, have come here to understudy our programs. So in the provision of health care through Agenda 5 of Mr. Governor, we have been contributing our own quota. So we have strived, and all the drugs, all the hospital consumables that the people are using to service these people in the selected 34 health centers have been provided through this organization. And people have been attesting to the quality of service we render.
As a testimony to the commitment of the state government to sustain the free health program, the 35 health facilities across the state received stock of drugs and consumables worth 34 million naira. Apart from drugs, some vital equipment like medical record tools, solar freezers, and other basic medical essentials were purchased. Besides the initial commitment made by the government towards the program, an additional 250 million naira was also approved for the implementation of the program. About 30% of the amount was committed to the procurement of 34 laptops, 16 new 10 kVA generators, 8 ultrasound machines, 24 hematocrit centrifuges, binocular microscopes, as well as provision of pipe-borne water in all the 34 health centers. The program review shows that a total of 37,539 people benefited from the free health services program of this administration in 2011. About 30% of the beneficiaries were children within a considerable category. About 3% were pregnant women, while about 52% were elderly citizens within the eligible status. The treatment covers various degrees of ailments like malaria, diarrhea, pneumonia, hypertension, arthritis, diabetes, tuberculosis, and injuries. The Free Health Mission is a unique initiative of the Fayemi administration. It was designed to take medical intervention to Ekiti people in their various communities within the state. The 4 previous editions witnessed a convocation of medical experts attending to various sections of Ekiti people who've been facing some form of medical challenge or another. The program covers dental services, high care services, provision of essential drugs, outpatient services, simple emergency services, and so on. The program, which was launched in January 2011, recorded a total number of about 230,000 beneficiaries as of December 2011. The Free Health Mission has been said to be unique based on the fact that qualified medical specialists and consultants with credible and verifiable medical backgrounds form the group of medical interventionists and volunteers that attend to Ekiti people. Some of the beneficiaries of this year's edition have this to say.
For example, I just put to bed day 4 yesterday and everything was free. In fact, I enjoyed coming to the health center.
Everything is good. It's a free health. If we came in, they will give us medicine. Everything is good.
Recognizing the need to consistently lubricate the wheel of the free health policy of the administration, aside from the provision of equipment, drugs, and other consumables, the Ministry of Health, on the auspices of the Ekiti State Government, has embarked on capacity-building programs.
In the Ministry of Health, most especially the Commissioner, he do pump in at any time to see what we are doing. And he usually train us, advise us, counsel us on this health line. Then those people working in the Ministry of Health, like the PS, Dr. Ujo, Dr. Idek, and some other people, they've been doing their best. They do organize training from time to time.
This agency has been able to achieve some things in the area of monitoring and supervision of all our primary healthcare centers across the 16 local government areas. We have a system in place whereby we monitor our primary healthcare workers, supervising them, mentoring them, giving them hands-on support on what they're supposed to do so that healthcare delivery can get to the people at the grassroots level. Apart from this, we have received a lot of support from His Excellency in the area of all the primary healthcare interventions. This year alone, we have supported people who have been trained as a trainer of trainers in the area of life-saving skills. And we have already cascaded this training down by training another set of nurses and midwives, up to 30 in number this year alone. These people are supposed to go out and have close supervision, monitoring on maternal and child health services in the primary healthcare centers so that we can altogether reduce maternal morbidity and mortality in the Ekiti state.
A total of 405,000 health workers have been variously trained. Some of the training programs, the health personnel were sponsored to attend to improve the quality healthcare delivery as envisioned by the government of Dr. Kayode Fayemi and contained in the 5th agenda include facilitation skills program, supervision and follow-up training on the integrated management of childhood illness, IMCI, life-saving skills program and IMCI for 100 nurses and midwives, life-saving skills programs and IMCI for 17 nurses and midwives from primary health care and secondary health care facilities across the state. Training of 120 role model caregivers on home management of malaria disease and usage of current drugs. Training on focused antenatal care and orientation meeting for community members on safe motherhood for primary health care workers. Training of 120 private patient medicine vendors. Training of 70 private medical practitioners on trends of malaria disease and usage of new drugs. Training of 50 private pharmacists on procurement quantification and forecasting. Training of 320 health facility focal persons and role model caregivers on home management of malaria disease. Training of health facility focal persons in all the 16 local government areas on procurement quantification and forecasting. Training of 2,000 CDDS. Sensitization program on CDTI for 173 community leaders. Sensitization program for septic techniques in clinical management attended by 120 workers. Continuing education seminar attended by 107 nurses. And finally, capacity building workshop for occupational health and safety officers for 16 participants. The state government has purchased more ambulances to strengthen the ambulance services. This is to further facilitate quick access to medical attention in cases of emergency. Aside from the various health intervention programs, there have been various health initiatives towards the accomplishment of the fifth agenda of this administration. One of such is the provision of financial assistance to those who need them. Over 72 million naira has been disbursed by way of assistance to improve the health of various persons whose conditions require such help. 18 million naira worth of prosthetics and other aid materials were also distributed to the physically challenged people. In recognition of the importance of information to an effective healthcare system, the HMIS was enhanced for collection and processing of data in order to provide an evidence-based review of performance of health system in the state. This brought about the completion of an ultra-modern health data bank for the proper storage and supply of health data. In addition to this, the software for health information management functions is being further enhanced to automate data collection and transmission using a web-based software. 34 motorcycles were purchased to facilitate the collection and collation of data. The Ekiti State Council on Health held its fifth session, in which all the memos presented and considered were approved. To further confirm the proactiveness and national appreciation of the ability of the Ekiti State Ministry of Health to key into the fundamental national health framework, 72% of the memos submitted by the Ekiti delegation to the 54th National Council on Health was also approved. That marked the highest so far. The Ekiti State Ministry of Health is setting a pace in regulating the practice of medical and allied professions. There is supportive and effective supervision of the nursing education. This is to ensure effective service delivery based on ethical standard. There is also the regulation of private health institutions through proper registration, orientation, and regular education program. Efforts are on to effect the passage into law on the guideline of the operation of private health institutions in the state. From all indications, the Ekiti State Ministry of Health is taking giant strides towards the accomplishment of the fifth agenda.
The only challenge that I need government to improve on, this our blueprint is not properly roofed. All the rooms here are leaking. If there is rainfall, every room will be full with water.
Healthcare delivery system is not something which the government alone can do. And then what we are trying to say is that we should still have to put in place a sustainable healthcare financing system, like issue of a health insurance system. And the government has been taking a very proactive measure on this. The Honorable Commissioner, with the approval of Mr. Governor, had visited Abuja to solicit for the introduction and implementation of a community-based health insurance scheme. So through that, there is going to be a sort of pool system in which every person will have access, at least minimum of 4 in a family will have access to health without any hindrance of being able to pay.
The major challenge are in two folds: one area of infrastructure and area of personnel. Like I told you earlier, the majority of our hospitals were built over 40 years ago, and in the buildings are crying for upgrading, they are crying for repair. If you give the states now, if you give me 2 billion now today, they will not be enough to do all these things. So that's a major challenge, and we need to prioritize many of our improvements in this place, in this hospital too, are archaic, and we need to replace them, and everything costs money. In respect of personnel, it's a major challenge, particularly in the primary health care, where we need to have a lot of nurses. We don't have nurses. The nation is not training much of nurses. The nation is not training much of nurses, and we do not have. For instance, now the whole of Ekiti State has only one school of nursing, and the maximum capacity they can produce is just 50. And if you read they produce 50 today, if you display to 20 years, that's an average of 5 nurses per. Don't forget some of them are retired. So it's a major challenge. And to keep them, to keep many of these people on board is difficult. Very, very difficult. And there's what called job mobility. Many of the 80% of the nurses are women. They either follow their husband to where their husbands are transferred to. And don't forget again that this brain drain event. I can tell you today that 6% of our nurses go to England, go to America, and go to Canada because of looking for connection. And finally, the major challenge is this untitlization for our health services. Because many of our women, they come for antenatal. At any training day, you see about 80-100, but only about 30 to 40% of them come to deliver in the acceptable basic health centers and hospitals. We are skilled birth attendants to see them.
The robust work plan of the ministry for the year 2012 is steadily being covered. The procurement process, which some ministries find challenging due to what most people refer to as bureaucratic bottlenecks, is being glided through. Services, essential equipment, and materials for healthcare services are procured with considerable and relative ease. This is partly because of the conscious timeliness in commencing the process, and partly because of the commitment to ethical medical standards of promptness to save lives.